So we're going to do a newborn exam on your little baby. So first of all, what I'd like to do is just get a sense of how the baby is growing. So we're going to weigh your baby and measure your baby. So first of all, we'll just bring the baby over to the scale. Get the baby out here. Make sure that the scale is on and it's zeroed. Yeah, it says 0 there. So we'll put baby on. And we always take the weight in grams. And so we'll get you to write down your baby's weight. Good. And then we'll bring baby over here. And we'll weigh and we'll measure your baby. So sometimes we use this kind of measuring device where we put the baby's head all the way up to the top. And then the baby can be on a blanket, but then we push this to the baby's flat feet. And then that tells us the number of centimeters here. Or we can use a paper or a reusable tape measure and measure the baby's length that way. So in centimeters, we start at the top. And sometimes it's hard to measure a baby's length because they tend to curl up. So it's helpful if you just mark where the head is, either with the edge of the blanket or with something like this. Put the top of the tape measure there and then stretch it out. And then you may need to stretch the baby's leg out so you can get the length there. So often I'll just make a tear in the tape there so I'll remember what that is. And then we can do the baby's head circumference. When you do the baby's head circumference, you want to go down around the biggest part of the baby's head. So you want to go around the forehead and also the bulge at the back of the baby's head. And then you kind of get the hat size. And then we usually make a tear there so that we don't forget. And then we can write those down, keep track of them in the growth chart. So then we'll have just a look head to toe of this baby. So we always start at the head. Your baby's lovely and alert, nice, good tone, and the color is good. The baby doesn't look pale at all. Nice color around the lips and the eyes. So let's just start with the head. So when we check a baby's head, we're looking for any bulging that may be like a cephalohematoma or caplet if it's right after the birth, and that's when the head is elongated from the pressure in the birth canal. This baby's head is nice and round, so we check for the soft spots on the baby's head. So the baby has a suture line here and also 2 suture lines here and across the front. So those bones are actually able to overlap. So in the middle, in the juncture between those suture lines, we have soft spots or fontanelles. The back soft spot is very small, and that closes up in about 6 weeks. So I just check and make sure that feels fine. The front soft spot is, or the fontanelle is bigger. There's a variety of ranges that's normal for the size of that soft spot. It could be from the size of a fingertip to actually 3 centimeters across. And so we just want to check that and make sure it doesn't feel like it's too big or small, like it's bulging at all, or indented. So your baby's soft spot feels totally fine there. So then we'll just carry on down. We check the placement of the baby's ears to make sure that the top of the ears line up with the eyebrows and that they're the same. We check the formation of the baby's ears to make sure that they look normal. You can pinch the cartilage a little bit to make sure it springs back to a normal shape. Then we check the baby's eyes. These baby's eyes look nice and alert. I don't see any yellow in the sclera, which may indicate jaundice. I'm going to check the baby's red reflexes. The red reflexes is when you see the retina in the back of the baby's eye reflecting back to you. That's showing us that there is no obstructions from the back of the eye to the front, so something like glaucoma or any tumors in the eye. So we're just going to look like this. I start off to the side, I look through here, and I shine the light into the baby's eye, and then I see in the pupil a red shining color shining back at me. I'm going to just check that side as well. And so those reflexes are both present. So that's great. I'm just going to check the baby's nose. I'm going to have a look with the light inside the baby's mouth. So in the baby's mouth, I'm looking for any signs of thrush or tongue tie. I want to see that the baby can push its tongue out past the bottom gum. That tells us that the tongue is able to move well for breastfeeding motion. Is it okay with you if I put my finger inside your baby's mouth to check for the baby suck reflex?
Yes.
Okay, so I put my finger inside the baby's mouth up to about my second knuckle, and I just slide it along the top of the palate. So when I do that, I can check the formation of the palate to make sure that it's complete and that we don't have any cleft in the palate there. And then usually the baby will just start sucking on my finger. If the baby doesn't suck right away, I could kind of like tickle the top of the mouth a little bit like this, and that usually makes the baby suck. And that way I can tell the strength of the baby's suck and the coordination of the suck. It actually should feel like a vacuum cleaner on my finger. So then that feels fine. So then I'm going to go down and check your baby's neck. With the neck, we want to make sure that baby can turn its head both ways, and that the baby doesn't tend to favor one side all the time. Sometimes that can happen after birth, but requires a bit of treatment. Then I come and check the collarbones. So the collarbones here, I just want to make sure that they didn't get damaged during the delivery and they feel fine. And then the long bones of the arms feel fine. Do this kind of assessment just to make sure that they're fine. On the baby's hands, I like to take a look at the baby's hands and make sure that the creases look normal, that the fingers can splay out, there's a correct number of digits. And then for reflexes, I put my thumbs in the baby's hands and they should grasp the hand like that. So your baby is grasping beautifully, really good reflexes there. And then we want to know the strength of your baby. So with baby grasping my hands, I'll lift baby slightly up, and that shows me that the baby's got the right amount of strength in her body here. So that's great. So carrying on down the baby's body, I'm just going to check the chest. The baby often will have some hard nipple buds, and so what that is it's just a little bit of reaction from the mother's hormones. That usually goes away within a week or two, and we just want to make sure that it doesn't get inflamed or too red looking, and your baby looks fine. Sometimes there's even a little bit of white discharge from there, but that looks fine. While I'm here, I'll have a good listen to your baby's heart and lungs. So I'll just get my little stethoscope here. And when I listen to baby's heart, I'm going to listen to 5 different places so I can hear all the different valves opening and closing. So I'm going to have a listen here and here, listen here, and then over here so I can hear the apical pulse. So your baby's heart sounds really good. And the heart rate, I'll just count that. The heart rate is very normal as well. And so I also have, because your baby's nice and quiet right now, I'll also have a nice listen to the lungs. So I'll try to listen to all of the lung fields here, one over on the side, and one here. And then I'll listen on this side, 2 lobes of the lungs on the left side. And your baby's heart sounds great, and your baby's lungs sound nice and clear. I don't hear any murmurs, and I don't hear any obstructions in the lungs from the top to the bottom. So the next part of the newborn exam is to check your baby's abdomen. So I find it really helps to do a head to toe assessment like this because then you don't forget anything along the way. So when I check the baby's abdomen, I like to split the baby's tummy up into 4 sections. So this is the upper left and right quadrants and the lower left and right quadrants. So just do a little palpation on each side to see if it seems to cause baby any discomfort and if I feel any masses in there. I like to check up under the ribs on the right side to see if I can feel the edge of the baby's liver, which I shouldn't quite be able to feel unless it's enlarged. And everything seems to be feeling really normal there. I also have a little listen to the baby's abdomen to listen to the sounds of the air moving around. That helps me be reassured that there's not any bowel obstructions at all. And then, of course, we're going to watch for your baby to start having dirty diapers, and that's going to help us give us more information of how the tummy is working. The umbilical cord stump is going to take about a week to dry up, and we just watch that. I'm just going to take a look here and make sure it's got 3 vessels in the end of the cord, and it does. The baby's supposed to have 2 arteries and a vein in the umbilical cord, so we just always make sure that all 3 of them are there. You don't have to do anything to take care of this cord. You just leave it alone. I'll show you how to keep it up out of the diaper so it doesn't get wet. It's okay to get it wet when you bathe baby, but then you just air dry it afterwards. So we'll keep checking that on postnatal appointments. Then I'm going to check your down into your baby's pelvis. We're going to check the inguinal pulses here. So I'm just going to put my fingers here and here. And I'm just going to feel the pulses there. I want to make sure that they're strong and equal on both sides. And they feel fine. We'll check your baby's genitals if that's okay with you. So this baby, if we have female genitals, then it's normal for them to look a little bit swollen. And that is all the effects from the birth and the mother's hormones, and that will calm down after about 48 hours. And so we just want to make sure that everything's formed properly. It's normal to have some white mucus coming out from the genitals, and sometimes with a little girl, even a little bit of red blood that happens in the first 24 hours. It's usually just a very small amount. And that as well as from the mother's hormones. So we also just check the anus as well to make sure the anus looks patent, and that when your baby has the first bowel movement is going to give us more information about that. But your baby's genitals look like they're formed normally. If it's a baby boy, we check and make sure that the opening to the urethra looks normal. And again, when your baby starts voiding and peeing, then that's going to show us that that works. And then we also check the scrotum and make sure that both of the testes are descended. Sometimes one of the testes is up higher at birth, and then it comes down after a few days or weeks. So we'll just keep an eye on that, and we'll let you know if there's any follow-up that needs to be done with that. And then we check your baby's legs. So when we check the legs, we'd like to straighten the legs out and put them, make sure all the creases are symmetrical and the legs are the same length. We're going to check the baby's feet and the reflexes on the feet. When I do this to your baby's feet, the toes should splay out, and then when I press here on the balls of the foot, the toes should curl in. So that tells us that the reflexes are working well there. And then we want to check your baby's hip joints. Now this is the most uncomfortable looking part of the newborn exam, and so just be assured it doesn't hurt your baby. Babies are very bendy. I'm just actually going to use a different doll to show this one, so just because these legs bend a little bit more. So when I check the hips, I put both legs bent up so the knees are against the abdomen, and I hold on to the legs with my fingers and thumbs. And then we want to open the legs this way and back in again. You can do them one at a time, or you can do them both together. But you want to do a movement out and in, and then also around in a circle. And so what we're feeling for and listening for is any clicking in the hip joint that tells us that there may be a dysplasia in that joint where it doesn't have a proper range of movement, where it moves smoothly. So that is something that we'll check again when your baby is 6 weeks old. It feels fine. And then we also, and then we're just also assessing the movement of the hips when we move the baby's legs around. So then we'll turn baby over and look at your baby's back. So babies often like lying on their tummies like this, and it's important to let them do that and have some tummy time every day. That helps them develop their abdominal muscles, their core strength, and also their neck muscles that they'll need for learning how to crawl. So I'm just looking at the baby's spine. I like to just check the spine with my fingers to make sure it feels complete and straight. Your baby's spine feels fine. I check the dimple at the base of the spine. Sometimes babies have a dimple that's very deep, and sometimes there's hair growing from it. Sometimes there's a sinus that's open at the bottom that goes into the spinal column. So if it's okay with you, I'm just going to open a little bit and take a look in there. So for your baby, it looks like I can see the bottom of that dimple, and there's no abnormal hair growth, and everything looks fine. Great. Okay. So That concludes the newborn exam. Your baby looks really healthy, and we'll continue to assess anytime you have a concern or at regular intervals until your baby is 6 weeks old. These are things you can watch for at home as well. And if you have any concerns, you give us a call. But your baby looks very healthy. Congratulations.